If you have a specific question for a specific member of the panel, please do say so. And we've got 20 minutes, so we need to keep the questions short and the answers brief as well. So, yes, please, madam.
Women for Justice and Peace. People talk about developed countries and developing countries, but there is a very tragic set of people who are in countries, one part of which is developed, and one part is underdeveloped and oppressed. And these people get a very low attention, nearly nil attention from the rest of the world. What do we do about that?
Thank you.
For example, just one, Sri Lanka, one part, the World Bank has said that one part is middle income country, the other part is less than $1 a day, and oppressed aid agents can't even reach. What do we do about it?
Thank you. I'm going to ask Una to have a go at that one because you highlighted Sri Lanka. If you'd like to move, talk to the microphone, that'd be good.
I don't actually have very much to say. I think it's not. I'm not really a development person, so I think it would be challenging to think how to reach very, very marginalized populations. But I think maybe it's something other speakers can comment on. I'm sorry.
No, don't worry. Nicola, do you want to have a go at that?
I think I would say that's why the work that we've been doing at ODI that looks at both economic and social vulnerability as the focus of social protection programming is so important. So I think the kind of people that you're talking about are excluded for not just economic reasons, but also probably due to caste, religion, or other types of intersecting factors. So I think having a dual social and economic risk and vulnerability framework is critical for that.
Okay, thank you. Yes, please.
I'm Georgina Lewis. I have no particular affiliation, but I did some work with Mary Stopes in Bolivia recently. I'm quite interested to hear about the issues around whether or not cash transfers incentivize pregnancy. As you mentioned, in Bolivia, there's been the Bono Juana Azordui, which has been a really big program, very high profile in Bolivia. Quite a lot of the Mary Stopes team there actually felt that the government was incentivizing pregnancy, incentivizing birth as a part of that program. So I wonder, is there any robust evidence that's been collected at all which would indicate that women do actually change their mind based on those cash transfers? Because I found that it was maybe a little bit insulting to women to assume that they wouldn't think that far ahead, because the cash transfers obviously are very small in comparison to the cost of a child in the long run.
Who'd like to answer that one? I mean, Nicola, is there evidence?
I think your point about is there robust evidence is very important. I mean, I think what we're finding are some case studies from some, very small scale qualitative research, and I think we definitely wouldn't want to conclude that. I think we did find in the programs in Ethiopia, for instance, that where there were strong cultural value placed on large families, then this was seen by at least some of the male focus group respondents that this could be a positive means for achieving that. And then some concerns that it might de-incentivize the use of family planning. I think you've got to remember that this is cash injected into very, very poor communities. So I think the point was not to question women's ability, but just to think about the broader sociocultural context in which she's living, but also to make sure that when these programs are introduced that they're twinned with behavioral and attitudinal change components as well. I think that's the critical thing, is to understand why these programs are being introduced.
Thanks.
I was very surprised as you. I couldn't have conceived that a woman would have a child for such a small amount of money. But I think there is some evidence emerging from the India JSY program that Tim Powell-Jackson has been looking at that suggests there might be some increases in fertility. But it's hard to work out whether this is sort of an overall, are women having more children, or are they just shifting to have their pregnancy earlier because they think this is a good thing and it might not be there forever. So I think to really evaluate long-term fertility impacts, you also need some time as well.
Thank you. Yes, sir.
Hello, my name's Coy Thompson. I'm Chief Executive of Children in Crisis, but I'm also chair of the Grow Up Free from Poverty Coalition, which has been promoting social protection for some time now. I want to thank the panelists for some really good data and analysis, really appreciated. And it seems not a week goes by without an opportunity to hear from some sector compelling evidence about the role that social protection and cash transfers have on child nutrition, on old age, on maternal health and so on and so forth. And the question I have to the panel is, I'm just wondering whether we're being helpful actually to the social protection debate and whether we have to step up to a different way of talking about things, because we're fragmenting the debates. We're allowing the donors to pick and choose how they want to promote. Is it cash transfers? Is it social protection? Is it child nutrition? Is it pensions? Whatever. And I think the evidence is they're political projects. If you look at Bolsa Familia or Bolsa Escola or Progressio or Oportunidades, the interesting thing is why it took within the electorate, why the politicians went with it. And often it was against the advice of the donors who wanted to over-technicalize, over-complicate, over-target, and so on and so forth. And I just wonder, to kind of condense this question, if there was a summit next week and you learned that people were sympathetic to social protection, what would you suggest to the politicians they should be buying into? What's the big idea that would take these ideas forward? Or would you ask for death by pilots and more research, or something really brave to take us forward on this issue? Because I think the evidence is compelling. I think we need to change the way we talk about it, though.
Thank you, Cor. I wrote pilots and crossed it out several times as well. Can I start this then? Because I think that's a big question. Leah, whose idea was the voucher scheme, and what message would you give to the summit?
I think the message we would give is, let's use the infrastructure that's there, and not be ideological about whether it's public or private. Why restrict social protection to only one or the other? The creation of the NHS isn't regarded as a moment of privatisation. It's regarded as a moment of nationalisation, and yet it was the government taking ownership of private health providers that really scaled up access to healthcare in the UK. For some reason, this has long remained a very marginal issue when we look at health services in developing countries.
Thanks. Una, I know it isn't your special subject. Do you want to pass on that one? Nicola.
For the big message at the symposium, that you need a package of social protection interventions, that government should be investing in a package, certainly not one program as a magic bullet. And whatever is introduced should have longitudinal monitoring and evaluation embedded from the outset. And that needs to be framed with a gender and age-sensitive vulnerability assessment.
Thanks. Maxine, do you want to have a go on that one?
Just a quick one to respond to the point about government capture, or what is government's, kind of stake in it politically. I think that is something that's actually quite an important issue and is being addressed in various ways. I think Oportunidades did try to detach, the program from political identification, but there are lots of other examples. Take Nicaragua with Daniel Ortega's particular sort of intervention, which is absolutely directed at capturing votes and mobilizing the woman voter. How do you prevent that? You have to sort of build in forms of making quite clear that this is a right, that people have the right to this form of social protection, and it isn't a favour from the government. But of course, that's just an additional point to Nicola's, which I support.
Thanks very much indeed. Yes, please.
Thanks. My name is Rachel Lander. I work for Interact Worldwide. We worked with ODI on implementing the cash transfers program in Africa, but also we work on a cross-European advocacy network called Action for Global Health. And universal health coverage is an issue we've really been working on to try and gain support for it among European governments and in the EU. And we've had some success in the positive messages that governments have been telling us is that, and including the UK government, that they are really happy to support governments to bring in universal health coverage and support the development of equitable health financing. But I just wondered what your kind of perspectives and experiences would be about how to really strengthen support for universal universal health coverage in country. A lot of health providers, from my own experiences, and I think the evidence shows that a lot of people feel that that people value health services more when they pay for them. And so there's kind of a resistance to bringing in more equitable health financing, including vouchers, across kind of public health services.
So resistance on the part of?
So resistance on the part of local people, of health providers, that they feel that there's a real value when people pay for a service. And people themselves will say, well, I know I'm getting a level of quality if I pay for it, and a variety of issues. Obviously, there's also issues relating to health system capacity, but I wondered also specifically for Leo on what is the role of private health providers on advocating and strengthening civil society to increase or rather narrow the distance between government and local people so they can actually demand to their governments what they want in terms of access to health services.
Yeah, have a go at that.
Thanks. Yeah, it's an interesting question. Why aren't the vouchers given out for free? Well, you know, there's two reasons for that. One is that we need to ensure that the vouchers that are given are actually used to the people we give them to. When you give something out for free, you know, anyone will take something for free, whether or not they have an intention of using it. If someone pays $1 or $1.20 for the voucher, it's like, I'm going to use this thing. I paid for it, and when I go and collect my service, if I don't like it, I'm going to take this voucher to someone who respects me, and that's a very powerful transition for a very low-income woman who otherwise feels like she is a recipient of charity, and is treated, you know, as if she's being done a favour by giving a health service she's entitled to.
Thanks. There is a real tension lurking at the heart of this conversation, which goes well beyond maternal health, which I think is understandably interesting to all of us, particularly when you see the donor community striving to understand what and how the private sector can or should get involved. You know, we're bumping up into that one quite a way. We've got one from a viewer online, so can we have that,
we've got
please?
Two questions from viewers online. The first one is from Roma Thompson, who's a student from SOAS, who'd like the panel to say a bit more about linkages to government funding for long-term stability in low-income countries. So what she really wants to know is there evidence to say that for realistic expectations for poor countries? So that's her question. And then a question from Rachel Cummings, who is the humanitarian health advisor from Save the Children. And she wants to know, in terms of health system strengthening, how can the private-public cash voucher system ensure that the competition raises the public system?
Okay, fine.
Okay.
Two focused questions. Nicola, do you want to have a go at one or other of those?
The first one on, is there evidence about long-term funding commitments in low-income country contexts? I mean, I think some of the examples we reviewed suggest there are. The examples of Nepal, of Bolivia, of Guatemala suggest that there are some good news stories. I think the much talked about sort of bad news stories is the Nicaraguan case, and that it was very much a political vehicle. But I think there are a lot of other, well, several other good news stories. You can find more about it in the background note we wrote and reviewed these programs in.
Okay, that was the first question. Interested in answering the second question, or are you going to pass that on?
Thanks. I think that's a really interesting and important question from Save. Yeah, we would love public sector clinics to participate in the voucher scheme and to have to up their game in order to continue to get low-income clients. And in Kenya, public clinics do indeed participate in the Kenyan voucher program. Tragically and ironically, the Ugandan Ministry of Health, while they like the program and support the program, have not given permission for public clinics to participate because they have a policy against user fees, which is a misinterpretation, I think, of the original ask of Uganda to remove its user fees. But that's always been cited as the reason why they're not participating in it.
Okay, we've got 3 or 4 minutes left. Can I just have a quick show of hands of people who've got burning questions? 1, 2, 3. We'll see if we can we take the 3 questions together, if you don't mind, and then we'll end up answering those. So first is here in the front row, please.
Thank you. My name's Caroline Harmshaw and I work for Interact Worldwide. I just wanted to understand a little bit more, actually, what you've just touched on, Leo, the interface between the private and state sector providers, particularly when it comes to the issue of reducing maternal mortality and the provision of emergency obstetric services and how that works. I suppose the overarching question is, does the provision of vouchers reduce maternal mortality through having very good referral systems into the public sector? Or how does that link work so that we can really see an impact in terms of safer motherhood?
Yeah, so...
yeah, do go ahead and answer that. And then over here, sorry, over here, please. Two over here.
The private sector hasn't got a bad reputation for serving the poor for no reason. Without a voucher scheme, if a poor woman goes to a private provider and starts receiving an obstetric service, maybe she's paid for it partially, or maybe she's receiving the service as a favour. If she then has a complication, is that provider going to go to the length of either providing her with the full service or with the transport costs of getting her to hospital? And I think in a lot of cases the answer is no. But with the voucher, it's explicit that the provider is going to be reimbursed for the cost of the service. So in the case of a complication, their reimbursement rate is higher, and it covers the cost of either the referral or the emergency obstetric service. And one of the outcomes of the programme is that we've seen much strengthened referral systems between private clinics and public hospitals being used for services beyond the voucher programme.
Thank you very much indeed. There'll be occasion after this to further clarify issues, but I do want to quickly allow our two other speakers, questioners. Yes, please, madam.
Yes, this is Katie Rulin from the Centre for Social Protection at IDS, and I have a question for Nicola on the impact of the cash transfers on safe motherhood. As you say, it's overlooked in many ways, but that holds for programs having safe motherhood as a program objective, as well as those not having it as a program objective. And you've presented some evidence, although the evidence base is thin, about potential positive effects. But is there any indication as to whether programs with a particular objective towards promoting safe motherhood are indeed more effective in reaching that goal than the programs without having that objective explicitly in their design?
Thank you. And can we then hear our final question before the answers? Thank you very much indeed.
Hi, my name is Geeta Bandy-Phillips.
Can you speak up so they can hear the other end? Don't speak into it, it's fine.
My name is Geeta Bandy-Phillips. I'm representing Women and Children First today. My question is for Leo. Leo, very basic question. For me, working in an NGO, it is the credibility I build is I have served the downtrodden, the people who have been discriminated over the ages, whether it's women, children, or based on your gender or color or whatever. The scheme you're talking about, vouchers, and the example you gave, the health worker actually said to you that some women don't come back because they can't afford it. By introducing a scheme where you have to pay for your health, are you discriminating the people who already been discriminated?
Thank you. So Nicola first, then Leo, and then we'll finish. Nicola.
It's a really good question. I think the short answer is there hasn't been a direct comparison, but I think sort of facets of the focused cash transfers for for safe motherhood programs that would be positive and suggest that it probably is more effective would be the fact that they are more focused in terms of the supply side, in terms of particularly addressing service deficits, but also in the particular incentives they have for individual providers and particularly for community health workers. So I think there's more targeted attention to the supply side deficits, which is something we often think about in cash transfers. Does increased demand, is that they're met with supply. And then there are also, not only for individual health providers, but then also for local governments, there's various incentives in terms of additional block grants that they can then do additional things with. So I think those facets would suggest they probably are more effective. But then I'd go back to the earlier point that I don't think I would then say we should be advocating for these types of programs rather than ones that see it as part of a bundled package per se. I think we have to look at the political economy dynamics as to what windows are there for introducing social protection in general, and then how do cash transfer programs fit into that piece more generally. Yeah.
Thank you, Nicola. And finally, Leo.
Thanks for the question. Yeah, the things with vouchers is you choose who your target population is, and if your target population is in a certain income group, you have to price the voucher at a level that can be afforded, you know, the market research that goes into that is a very important and substantial part of the program preparation stage.
So it's different from country to country?
I have to stop you because people can't hear you, but please continue the conversation because it's a really important one.
I just want to say, is it different from country to country or within the country, from place to place, city to rural?
So can you just repeat the question?
So is the price of the voucher different from country to country? The answer is yes, it is.
Okay. Thank you very much for that. I'm sorry for being so anal about process, but it's 1 o'clock. This is a really important issue. I'm a really slow learner, and I'm still struggling to try to work out who does what best. Is it the state? Is it the marketplace? Is it NGOs and those of us in our kind of civic society roles? It's an incredibly dynamic set of issues. And as we heard from Una, this is an issue that is unacceptable at the moment and needs to change. So thank you for your engagement in the issue. This marks ODI's contribution to International Women's Day, which is an important day, and I realised as I did my little bit of research that in a lot of countries it's a public holiday, and in several of those a public holiday only for women. Now how about that? So thank you for your attention. There is after lunch a round table which some of you are aware of, others of you aren't, and Nicola's just going to outline what it entails in case any of you are able to stay on and participate. But in the meantime, thank you very much indeed for your presence here and online. I hope it's been an interesting time.